Hello, I'm Dr. Muhammed Shamim. I'm the foot and ankle surgeon here at Insight Orthopedics and Sports Medicine. I started here at Insight back in September of 2023. I treat all foot and ankle ailments. I went to school at Kent State University in Cleveland, Ohio. After completing my doctorate degree, I went on to do a 3-year surgical residency at Wayne State University and Beaumont Hospital, Royal Oak, with a focus on foot and ankle traumatology and limb salvage. I then went on to do an optional year of fellowship at the Northwest Illinois Foot and Ankle Fellowship Foundation with a focus on total ankle replacements, peripheral nerve surgeries, complex foot and ankle reconstructions, including Lisfranc fixator use. I see individuals with all sorts of foot and ankle problems and ailments and different pathologies. My job is to make sure that you get back on your feet pain-free, pun intended. One of the things that I really enjoy most about my job is the investigative aspect of it. When someone comes in and they haven't been able to do their activities of daily living, or they haven't been able to partake in their athletic activities as they normally would. This could be, by getting x-rays or by doing diagnostic injections or even getting advanced imaging like CT scans or MRI, and kind of just figuring out and putting the pieces together to see what exactly the diagnosis is, and then offering treatment options and watching patients rehabilitate through various injuries or pathologies and problems, and seeing them really walk out of this clinic eventually pain-free. I think one of the things that surprises people these days is just how much advancement there's been in foot and ankle surgery. I have had a lot of patients that walk in and they might be surprised that they can actually start walking after surgery right away. Whereas previously, this wasn't the case. There's been a lot of advancement in what we call minimally invasive foot and ankle surgery with better techniques, better hardware, better approach. So I think this is one of the newer, more surprising aspects of our field that patients have encountered. One of the things that really aligned my beliefs with Insight were Insight's core values. Treating each patient with love, with respect, with individualized care. I think this really stood out to me, especially during my job process, where I felt like a lot of places treated patients as numbers, whereas here, we actually care, we treat the patient with love and respect. And another aspect was the multidisciplinary approach that we can take at this institution. We have pain management specialists upstairs. We've got neurosurgery as well. I work closely with our neurologist as well, as I will order specific testing if I feel like the patient has a peripheral nerve entrapment and whatnot. One of the lessons I've learned through my training was that medicine is a humble sport. The moment you get overconfident, it has a knack to come around and teach you a lesson. So, I treat all my patients with dignity, with respect, with love, and really make sure that I'm listening to them when they come and tell me about their foot and ankle problems. During my time off, I usually enjoy traveling with my wife, who is also here in Flint, training to be a nurse practitioner. I'm also a big sports junkie. I watch basketball, I watch cricket, I watch soccer and American football.